Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hello viewers, I Dr. Shikha welcome you all to THIP Media's show Health Files. Here we'll be discussing about the disease type 2 diabetes. Did you know that more than half of the people living with diabetes remain undiagnosed? In fact, in India, currently about 77 million people are suffering from type 2 diabetes and around 25 million people are pre-diabetics. So, to know about the disease, we'll be discussing the basic aspects of type 2 diabetes with our diabetologic expert, Dr. Surajeet Patra. Dr. Patra holds 17 years of experience and is currently a Director and Consultant Diabetologist at Surajeet Patra's Diabetic Clinic, Bhubaneswar. So, let's get going without further ado. Hello, Dr. Surajeet. Welcome to THIP Media.
Hello, Dr. Shikha.
Talking about diabetes, my first question to you is, what is type 2 diabetes?
Okay, so let me take one step before that. So diabetes, like as public awareness and people know that blood sugar is increased and that is called diabetes, but that is not the complete information. The complete information is there are different types of diabetes. Just blood sugar is increased, your fasting blood sugar or postprandial blood sugar is increased, that is diabetes. But most importantly, what is the type of diabetes? So there are different types of diabetes. Okay, the most common type of diabetes that is seen in 95% of situation is type 2 diabetes. Okay, there are other types like type 1 diabetes, then LADA, latent autoimmune diabetes of adult, and then MODI, maturity onset diabetes of young, and there are different types of diabetes. But the most common type, which is seen in 95% of cases, is type 2 diabetes. Okay, now what is this type 2 diabetes? Okay, so there is increase in blood sugar levels. Okay, and what is the cause, or what is the type 2 diabetes? Means it is mainly because of insulin resistance or insulin deficiency at the later stage. Okay, so where there is insulin resistance, there are different mechanisms, different metabolic mechanisms are there, and because of these mechanisms, and most important thing is obesity or increase in weight or increase in fat deposition in our liver or maybe pancreas. All this leads to insulin resistance. Insulin resistance means insulin is not able to work properly, and that is the root cause, and that can lead to increase in blood sugar, and this is called type 2 diabetes. Okay.
Moving forward, you just told about what is type 2 diabetes. Could you please elaborate what causes type 2 diabetes?
Okay. So if we can talk about the causes or the etiology of type 2 diabetes, the most important and the number one cause is obesity. Okay, obesity or overweight. Okay, so how to know that a person with type 2 diabetes or a person who is not known to have diabetes, he should know, or he must know, or she must know about the two important parameters. One is BMI, body mass index. Okay, weight in kg by height in meter square. That is a formula. And second is waist circumference. Okay, so in India, like globally, more than 25 BMI is considered as overweight, and then more than 30 is obesity. But in India, in Indian context, BMI of 23 or more than 23 is called as overweight. So this waist circumference or overweight or obesity, all these are the causes or the root causes which leads to insulin resistance and then can lead to type 2 diabetes. Okay, this is initial part of type 2 diabetes. When this type 2 diabetes becomes of long duration, more than 5 years, more than 10 years, then there is reduction in the insulin secretion from the pancreas. Okay, when type 2 diabetes is diagnosed, already 50% of beta cell of our pancreas is already lost at the time of diagnosis. So as the year progresses, the diabetes duration progresses, then this 50%, remaining 50% again becomes on a decreasing trend, maybe 40, 35, 30, depends. Okay, so there may be a stage where your beta cells or a person with type 2 diabetes beta cell or her beta cell may not be properly functional or optimally functional. In that situation, it is insulin deficiency. Okay, so initial part of type 2 diabetes, it is insulin resistance, Later part of type 2 diabetes, it may be due to insulin deficiency. So all these root causes like obesity, overweight, unhealthy food habits, lifestyle absolutely mismanagement, then your lack of physical activity or sedentary lifestyle, then sleep hygiene, sleep quality, sleep quantity, and then your stress. So lifestyle management consisting of 4 important parameters: diet, exercise, stress management, sleep hygiene. So all these factors leads to increase in weight, overweight, obesity, insulin resistance, insulin deficiency, type 2 diabetes. So this is like a journey, or this is like a progressive nature of the disease, that is type 2 diabetes. Okay.
Thank you for pointing out all the causes in such an elaborated way. Coming to my next question, could you please tell us what are the symptoms a person experiences when going through type 2 diabetes?
Okay. So this is most important point. Everyone should be aware of the symptoms of type 2 diabetes, we can say. So 3P, it is called 3P symptoms. So classical 3P. 3P means polyuria, polyphagia, polydipsia. So increase in your food intake, your hunger. Second is increase in thirst. And third is increase in your frequency of urination. Okay, these are classical symptoms. But in apart from these 3 classical symptoms or these 3P symptoms, like if you have any wound which is not healing properly or not healing in appropriate time, there is a delay in wound healing. That is one of the important factor where you must check your blood sugar levels. Okay. Then blurring of vision. Then your tingling sensation in your hands, palms, and legs. So that is called peripheral neuropathy. That could be one of the that is actually complications of diabetes, because that particular person is ignored or not known about whether he or she is having diabetes or not. So increase in urination, increase frequency of food hunger, and then increase in thirst, delay in wound healing, blurring of vision, tingling sensation or burning sensation in your hands, palm, and legs. These are classical symptoms which, if anyone is feeling any one of these, if you are feeling, you must check your blood sugar level as soon as possible.
Thank you for the information. Now that we know the symptoms, could you please tell us if type 2 diabetes is preventable? If yes, how so?
Okay, so very important point from the public awareness or public health point of view. Type 2 diabetes, basically it is a lifestyle disorder. Okay, lifestyle mismanagement, diet, exercise, stress management, sleep hygiene. These 4 topmost most important lifestyle factors. If there is mismanagement, this can lead to type 2 diabetes. So to prevent type 2 diabetes, we need to know. So there is something called normal, then pre-diabetes, and then diabetes. Okay. So how to know that? Just few information. One point is your fasting blood sugar. Second is postprandial blood sugar. But the most important one is HbA1c. So HbA1c talks about last 3 months average. Okay. If your HbA1c is less than 5.7, absolutely normal. 5.7 to 6.4, it is pre-diabetes. More than 6.5, more than equal to 6.5 is diabetes. Okay. Similarly, fasting blood sugar 70 to 100 normal, 101 to 125 pre-diabetes, more than equal to 126 fasting blood sugar diabetes. Okay. Now, how to prevent this? Number 1, lifestyle management. That is the first line therapy. For treatment also and for prevention, if you are not having, or if a person is not having diagnosed with type 2 diabetes at present, so he must know which stage of the journey he is, whether he is in normal, pre-diabetes, or diabetes. If he is normal, very good. Continue the lifestyle management, diet, exercise, stress management, sleep hygiene. And if he is pre-diabetes, then pre-diabetes is, it can be reversible. Pre-diabetes can be back to normal. How to do that? Lifestyle management, diet, balanced diet. Avoid your junk food. So in one day, for example, you must know, or people must know about carbohydrate counting or calorie intake per day. So carbohydrate counting is one of the important factor. Everyone must know about the basics of this. So if your 24-hour food intake, for example, let's say 1800 kilocalorie is optimum for you, depending on your BMI and other metabolic parameter. When you consult your like diabetologist or their team of diabetology, they will guide you what is the requirement for you in one day. For example, let's say 1800 kilocalorie is your requirement. And out of this 1800 kilocalorie, this is 24 hour, 1800 kilocalorie in 24 hour. This should be balanced, like 20 to 30% carbohydrate, 20 to 30% protein, 10-20% fat or good fat. Okay. Now this should be balanced diet. So diet is one of the important factors. Balanced diet, avoid junk food, avoid saturated fat. Then second part is exercise, or we call it physical activity. So if you are not having diabetes, or if you are having pre-diabetes or diabetes, minimum in 24 hours, 30 to 45 minutes of brisk walking. So brisk walking is the king of exercise. Okay. So there are different fancy things in social media. You can see this fitness regime, this regime, those regime. But whatever those things, brisk walking is the king of exercise. Okay. So in 24 hours, 30 to 45 minutes of brisk walking. You should have comfortable footwear. Okay. And not at a stretch. So there is another concept or another myth, like many patients in our clinic, that, sir, I am doing a morning walk every day. Okay, morning walk is good, but in 24 hours, whatever time is suiting for you, whatever time you have, in 24 hours, 30 to 45 minutes of brisk walking is the most important thing. You must maintain that. Okay. So 15 minutes maybe in the morning, 15 minutes in the evening, maybe after dinner, 10 minutes of walk. So in 24 hours, this is the physical activity, 30 to 45 minutes brisk walking in majority of the days. Okay. Third one, so diet and exercise. Third one is stress management. Stress. So stress is like a part of our life. There cannot be zero stress for anyone. Okay. But stress management. Do not overthink about any particular thing. Just manage that and try to be relaxed from that situation. It is easy to say, but stress is a part of everyone's life, personal life, professional life. So try to manage that, because stress or increase in stress that could lead to like our stress hormone, increase in stress hormone, and that can lead to increase in sugar or blood pressure or cholesterol. Okay. So stress management. Fourth one is sleep hygiene. Sleep hygiene means sleep quality plus sleep quantity. Sleep quantity, 7 hours of sleep in 24 hours. Sleep quality means sound sleep. There should not be disturbed, like multiple disturbances in those 7 hours can lead to derangement in the quality of sleep. So how to prevent type 2 diabetes? Just take care of your lifestyle management, diet, exercise, stress management, sleep hygiene. Okay, these are the 4 important factors you must take care at present and sustain this. So sustenance is the difficult part. You must take care of these things daily, and this should be part of your lifestyle. So blood sugar, blood pressure, blood cholesterol, all this should be within the normal limit. Okay.
Thank you so much for imparting such knowledge, and that too in so much detail. I believe it will be very helpful for our viewers. Adding to that, even if in some cases people try to prevent it, maybe because of genes or other factors, people still get diabetes. So if a person suffers from diabetes, how is he or she treated for it?
Okay. So the treatment of diabetes in general, we can say there are different types of diabetes. As I mentioned previously, there are different types of diabetes. For type 1 diabetes, let me tell you very frankly, type 1 diabetes, only one treatment, that is insulin. And this must be emphasized for anyone who is type 1 diabetes. Okay. For type 2 diabetes and other type of diabetes, LADA, MODI, there are different. There is like oral tablets are there, insulin are there, different situation, different metabolic parameter, different anthropometric parameter, depending on case to case basis. Your diabetologist can prescribe you depending on your HbA1c, blood pressure, cholesterol, all these parameters. Okay. But lifestyle management is first line therapy. Lifestyle management and diabetes education. Okay. So lifestyle management plus diabetes education, this is first line therapy. Over that, oral tablets or insulin, depending on your metabolic parameters, like your ABC. This is called ABCD mantra. Everyone, all our viewers, please note this. This is called ABCD mantra for treatment or management of type 2 diabetes. So diabetes education and lifestyle management, first line therapy. What is the ABCD mantra? A means HbA1c. That is the most important parameter. If your HbA1c is, like if you are a type 2 diabetes and your HbA1c is below 7%, that is good control. Below 6.5 is very good control. Okay. So early part of type 2 diabetes diagnosis, like for example, a person diagnosed now, so initial 5 to 6 years or initial 5 years, very, very important. This, if you take care of your ABCD in this initial 5 years, this can have a legacy effect. You can get benefit from the prevention of complications. Okay, so HbA1c less than 7 is called good control. Less than 6.5 is very good control. Diabetes is under control or not? How to know? Only one parameter, that is HbA1c. Less than 7, good control. Less than 6.5, very good control. B means blood pressure. 120 by 80 millimeter mercury, absolutely fantastic. Less than 130 by 80. So type 2 diabetes, person with type 2 diabetes, blood pressure, he should maintain less than equal to 130 by 80. That is the goal. Okay. C means cholesterol. Cholesterol, there are different parameters like total cholesterol, triglyceride, HDL, LDL, VLDL. Among these 5, LDL, the bad cholesterol is LDL. That is the most important one. That should be less than 70, less than 70 milligram per deciliter. And triglyceride should be less than 150 milligram per deciliter. And this is ABC, HbA1c, blood pressure, cholesterol. D is diet, exercise, lifestyle management, and diabetologist consultation at regular intervals. Okay, so this is ABCD mantra. For treatment or for management of type 2 diabetes, 3 important points. Number 1, lifestyle management, first line therapy, adherence to the lifestyle management. It should be part of your life. Okay, so lifestyle management plus diabetes education. Second is your oral tablets or insulin, depending on your case-to-case basis, depending on your anthropometric and metabolic parameter. Your diabetologist will discuss with you and he can prescribe you that. What is the goal of treatment? Why we need treatment of type 2 diabetes? The goal is to prevent the complications of diabetes. Okay, and to have a better quality of life.
Coming to our next question, what are the goals of management of type 2 diabetes?
Okay, so this is most important and this is part of diabetes education. For every patient or every person which I interact, I tell them ABCD mantra or what is the goal of why you require the treatment or why you require management of type 2 diabetes. The goal is to prevent the complications of diabetes. Okay, so what are the complications, like, from top to toe? Heart, liver, kidney, brain, leg amputation, all these are dreaded complications of type 2 diabetes. At present, globally and in India, number 1 killer is heart attack. That is called coronary artery disease, heart attack. What is the root cause of heart attack? Number 1 cause is diabetes. So if you want to prevent the number 1 killer, you need to take care of your diabetes. And diabetes means not just fasting and PP. This is the general public myth that, okay, my fasting blood sugar is like this, my postprandial is like this, it is under good control, I am doing good. No, absolutely. You must take care of your ABCD, HbA1c, blood pressure, and cholesterol. If you take care of ABC, then the number 1 killer, heart attack, that can be prevented. Number 1 killer, heart attack. Number 1 cause of heart attack is diabetes. So this is diabetes education. You must be aware. Okay. Now, what is the goal? Goal is to prevent the complications. Heart attack is the number 1 killer. Other than that, brain stroke, neuropathy, peripheral neuropathy, your leg amputation, peripheral vascular disease. So leg amputation, most dreaded complications. All these complications can lead to derangement or poor quality of life. Okay, so the goal of type 2 diabetes management is to prevent the complications of diabetes and to have a better quality of life.
Thank you so much. My next question is, can home remedies cure type 2 diabetes?
Okay, so answer is one word, no. Okay, so what is treatment? Just now we discussed lifestyle management, first line therapy, and then oral tablets or insulin, depending on case-to-case basis. Okay. Now, home remedy means, like, what is the definition of home remedy? Let's say, based on our experience, our patients in our clinic, they say their lifestyle or their daily this home remedy type of thing. Like, for example, karela ka juice, jamun ka juice, methi ka pani, something like this. These are few examples. Okay. All these things are coming under lifestyle management. Lifestyle management, as I mentioned, diet, exercise, stress management, sleep hygiene. Whatever you are doing, this karela ka juice, methi ka juice, or jamun ka juice, all these are like part of your diet. Like if I am taking green leafy vegetable, that is fine. If that same green leafy vegetable, I prepare a juice and I will take that juice, that is fine. That is part of lifestyle management. That is part of diet. That is fine. You can take that. But there is some myth, or there are some patients, they say that they are taking Karela ka juice and they are thinking that their sugar is now under good control and they stop medicine. That's the problem. On your own, do not stop medicine. You talk to your doctor, your diabetologist can reduce the medicine depending on your HbA1c. Okay. And there is a recent concept of remission of type 2 diabetes. We will discuss later on that part. But home remedies are part of your lifestyle management. Okay. If that is helping for you, like it cannot be a generalized thing that it will help for everyone. Depending on case to case basis, you monitor your HbA1c every 3 months. Okay. If your HbA1c with all your home remedies plus medicine and plus your lifestyle management plus medicine, if you are keeping it below 7, good control, below 6.5, very good control. So home remedies are part of lifestyle management. So lifestyle management plus medicine is the part of treatment. If you are able to maintain your HbA1c below 6.5 only with lifestyle management, that is very good. Ultimate thing is your marker HbA1c must be below 7 or below 6.5. Whatever intervention you are doing, home remedy, I am okay with that till the time you do not stop the medicine on your own. If your doctor is saying to reduce the medicine, stop the medicine, that is fine. Under medical guidance, it is fine, but not on your own. Okay. So home remedy is part of lifestyle management.
Thank you for imparting this knowledge. I believe the users will not be going after Karela juice and all as a sole treatment purpose.
This whole treatment, yes, that is the point I would like to emphasize.
Yeah. Thank you. Dr. Surajeet, my last question to you is, can type 2 diabetes be reversed? If yes, how so?
Okay. Okay, great. This is the most important question. In last couple of years, this is a buzzword. Every patient in our clinic, they have this particular doubt. In last, like I can say last 6 months, every patient, 99.99% of patients, like you can say every patient, they ask this question, sir, can I reverse my diabetes? Because there are a lot of buzz in social media, newspaper and everywhere. Okay. So 3 important points I would like to emphasize here. Number 1, this remission. So diabetes reversal, this term should not be used. There is nothing called diabetes reversal. If someone is using, that is the wrong word. Remission of type 2 diabetes. Okay. And this remission concept is applicable only in type 2 diabetes. So that's why I told in the beginning, every person with diabetes, they must know which type of diabetes they have. They should discuss with their diabetologist. Okay, which type of diabetes? Just diabetes, a general term or a blanket term is not the right thing. Which type of diabetes? Now coming to this remission, remission is applicable only in type 2 diabetes. Okay, now what is this remission? So for example, HbA1c, I mentioned before, that is the most important marker of your sugar control. HbA1c talks about last 3 months, last 2 to 3 months average blood sugar. Okay. Now, if your HbA1c, for example, at present, a person with type 2 diabetes, HbA1c currently, for example, let's say 10.0, for example. Okay. Now, in this 10.0 HbA1c, what is the treatment plan? Lifestyle management plus diabetes education plus medicine or insulin, depending on case to case basis. Now, once this person take care of lifestyle management plus medicine or insulin, HbA1c comes down. Maybe after 3 months from 10.0, it may come down to less than 7, maybe less than 6.5. Okay. So if a person with HbA1c less than 6.5, okay, then in that situation, your treating physician or your diabetologist will obviously reduce the medication, because the medications or insulin units which is required when your HbA1c is 10.0, that may not be required when HbA1c becomes less than 6.5. Okay, so your diabetologist may reduce the medication or reduce the insulin dose. Okay, a stage may come where your HbA1c becomes less than 6.5 and your diabetologist can reduce and can stop the medicine for diabetes only. And if you are able to maintain that HbA1c below 6.5 without medicine for 3 months, that state is called as remission of type 2 diabetes. Okay. Now, how someone without medicine can able to maintain HbA1c below 6.5 for 3 months without medicine? The answer is lifestyle management, because lifestyle management is first line therapy. If you are able to achieve and maintain your HbA1c below 6.5 only with first line therapy, second line therapy, tablets are not required. But point is it possible for all types of diabetes? No, it is only in type 2 diabetes. It is applicable only in type 2 diabetes. Now, is it possible for all people of type 2 diabetes? The answer is no. That's where all the myths and all the social media buzz and fraud things are also going on. Let me tell you very frankly. If you are a type 2 diabetes in initial part of your diagnosis, maybe initial 6 years, or maybe at stretch initial 10 years, if you are overweight or obese, okay, and if your C peptide, that is one of the marker whether your insulin is optimally secreted from your pancreas or not. So there are certain criteria. Based on these criteria, your diabetologist can decide whether you are a right candidate for remission, for trying for the remission of type 2 diabetes. Okay, so every people or every person with type 2 diabetes may not be possible. If someone is telling you that you are a type 2 diabetes and all people of type 2 diabetes, I can do the remission, absolutely no. Initial 6 years, so who is an ideal candidate for remission? Initial 6 years of diabetes, type 2 diabetes, overweight or obesity, optimum C peptide, there is a blood test, you can do that. So optimum C peptide and without any complications of type 2 diabetes. If person is type 2 diabetes and already landed in some complications of type 2 diabetes, he is not the right candidate or not an ideal candidate for remission of type 2 diabetes. Okay, so this is a couple of important points regarding remission of type 2 diabetes. Yes, it is possible, but not in every person of type 2 diabetes. There are certain criteria. Depending on your own metabolic and anthropometric parameter, your diabetologist can guide you about whether you are a right candidate for remission or not. Okay, do not do without medical consultation, without consulting your diabetologist. Okay, that is the point to be remembered.
Thank you so much. It was indeed a wonderful session, and I believe our viewers will be immensely grateful to you for sharing such knowledge with us. Thank you for your time.
Thank you, Dr. Sika, and thank you, the team THIP, the Healthy Indian Project, for conducting this type of public awareness activity. This will be very helpful, and this will throw some light on the myths which are going on in people's life through various medias. Authentic information and imparting authentic information and increasing the public awareness is very important, and that is called diabetes education. So what we did in last half an hour is part of diabetes education. This is one of the first line therapy. Okay, so thank you, Dr. Sika, and thank you, team THIP. Okay,
thank you.
Bye.